Well, our health correspondent Ashish Joshi joins me now. So, Ashish, new numbers this morning, they don't make for good reading, even if perhaps it was sort of largely expected. And just yesterday, we were talking about an expected winter crisis making it worse.
There will be a winter crisis, but it all depends on the severity of this winter crisis, and that will be determined by several factors. One, the re-emergence of seasonal respiratory disorders, COVID, flu, all of these things. And yes, the Health Secretary is absolutely right to talk about bed capacity. There is still a problem, an ongoing problem with discharging patients, and that's why we saw the £200 million announced by the government for the NHS, for hospitals and acute trusts. But we also saw an additional £40 million for social care, an acknowledgement there, if one were needed, that more needs to be done in the social care sector so patients who are fit for discharge can be discharged from hospital, therefore freeing up capacity for incoming patients. That was a real problem last year through the winter. But the biggest problem, where the Health Secretary didn't acknowledge that in his interview this morning, was what he intends to do about the crippling strikes which are taking place in the health service. And that just adds to that record number, the 7.68. That grows and grows every time there's industrial action by junior doctors or consultants. The number of missed appointments rises by tens of thousands for each day. We're expecting one of the most significant weeks in the NHS next week for strike action, when junior doctors and consultants will strike together. That's going to virtually put the NHS at a standstill for those days, because everything will be geared up towards patient safety, keeping the front door open, making sure emergencies are dealt with, and nothing else will happen within that hospital. And that's every hospital where significant strike action is taking place. So that is the most urgent thing that needs addressing if the government, if the Health Secretary and Rishi Sunak is to meet his key pledge of bringing down that waiting list. They've got to resolve the industrial action that's taking place. And next week we're going to see that ramped up quite considerably.